Welcome to the NPTE Final Frontier podcast, helping one student at a time. Visit NPTEFF.com to enroll today so you can pass tomorrow.
Thank you for joining us here on the NPTE Final Frontier podcast. My name is Emily, and today I will be reviewing the difference between emphysema and chronic bronchitis. So both emphysema and chronic bronchitis are considered chronic lung diseases. So first, let's dive right into emphysema. Emphysema is characterized by permanent abnormal enlargement of the air spaces within the lungs and loss of elastic recoil of the lung tissue. There will be damage to the airways distal to the terminal bronchioles with alveolar wall destruction, which leads to airway collapse and gas trapping. There are two different types of air pockets, which include blebs or bullae. Blebs air pockets occur in between the alveoli, while bullae occur between the lung parenchyma, which will lead to increased dead space. One important thing to note is that long-standing chronic bronchitis can lead to the development of emphysema over time. The etiology of emphysema includes a history of smoking, exposure to pollutants, or it can be hereditary. So there are three different types of emphysema, which include centrilobular, panlobular, and paraseptal, or panicinar. So centrilobular emphysema is the most common type when inflammation develops in the bronchioles. Panlobular emphysema is when the most distal alveoli are affected, most commonly in the lower lungs. And finally, paraseptal or panicinar emphysema is when the alveoli in the lower lobes of the lungs are infected. Patients with emphysema are typically referred to as pink puffers. So clinical signs and symptoms of emphysema include shortness of breath, dyspnea on exertion, which is shortness of breath with exercise, orthopnea, which is shortness of breath upon laying flat, a chronic cough, barrel-chested appearance, weight loss or malaise, fatigue, use of accessory muscles for respiration, prolonged expiration such as grunting, wheezing, pursed lip breathing, an increased respiratory rate, or peripheral cyanosis. So now that we have reviewed emphysema, it's time to discuss chronic bronchitis. Chronic bronchitis is defined as anyone who coughs for at least 3 months per year for 2 consecutive years without any precipitating diseases. Chronic bronchitis is associated with prolonged exposure to nonspecific bronchial irritants such as smoking. It is characterized by inflammation and scarring of bronchial lining with mucopurulent sputum production. In chronic bronchitis, partial or complete blockage of airways is caused by the mucus secretions, thereby resulting in insufficient oxygenation in the alveoli. The etiology of chronic bronchitis includes a history of smoking, exposure to pollutants, or it can be genetic. Patients with chronic bronchitis are typically referred to as blue bloaters, unlike emphysema, which are referred to as pink bloaters or pink puffers. Clinical signs of chronic bronchitis include persistent cough with sputum production, which will be worse especially in the mornings or evenings, reduced chest expansion, wheezing, fever, shortness of breath, cyanosis, and or decreased exercise tolerance. So I hope you found this episode helpful reviewing the differences between emphysema and chronic bronchitis. Never forget, warriors, you are powerful, you are strong, you are a final frontier warrior, and you will pass. Thank you very much for listening. For more information on the NPTE Final Frontier, please visit npteff.com. You can check out all of our social media platforms, such as Facebook, Instagram, Twitter, and TikTok. Till next time, have a great day and a powerful tomorrow.